Hello everyone, my name is Amanda Granditz. I am a traumatic brain injury survivor and community mental health counseling graduate student. I know from my own experience how difficult it is for survivors to deal with their grief and would like to help their healthcare staff and caregivers learn important information to help them as they face their journey. Life has changed drastically for them and they do need your support in dealing with their grief as they accept their new lives. Some people may not believe that traumatic brain injury is a chronic disease, but after I read Leming's and Dickinson's definition, I believe or know that it is. Their definition of chronic disease states that it is a non-communicable, self-limiting disease from which the individual rarely recovers. Even though the symptoms of the disease can often be alleviated. With this definition in mind, traumatic brain injury is a chronic disease because the injury changes the brain forever. As Jodi Picoult says, but once you throw a stone, there are ripples in the pond even if you remove the rock. Doctors may be able to eradicate a brain defect, but the scars or the rock remain. And unfortunately, scar tissue can cause serious issues for survivors of traumatic brain injury. I would like to share with you what most of my fellow traumatic brain injury survivors feel is important for caregivers to know. Family members can help by offering emotional support and by learning as much as possible about the condition. This is a very crucial message because it is difficult to understand that traumatic brain injuries change people in ways that no one can see or may imagine. And these changes can cause serious damage to the survivor's personal relationships. Leming and Dickinson discuss how being in the hospital affects the survivor's self-esteem, goal orientation, and reduction of loneliness. It is difficult to go from a regular life and suddenly know that the survivors have to leave their normal lives and be at the hospital for testing and surgery to fix their brain. The survivors lose control over simple tasks that they are accustomed to doing every day to the healthcare staff or their loved ones. The survivors also lose control because the knowledge about the survivor's fate is in the doctor and nurse's hands, and the survivors are often the last to know what is happening. Even after the survivors talk to the doctor, it is hard to understand what they should do next. Should they ask for a second opinion, do some research, or do what the doctor suggests is best? When survivors hear that they need to have a coil, an embolization, a gamma knife surgery, or any other treatment, it is often scary and he or she may want to learn more before moving on. It is important for family and friends to imagine what they would do in the same situation and not rush survivors into making a decision right away. Even though it is important to act fast, it is the survivor's body and decision. Sometimes the survivors feel as though they have to be a teacher within the hospital system. For example, when I went for an EEG, a test to measure the electric activity of a person's brain, I had the technician ask me what an AVM is. Being able to tell her that it was an abnormal tangle of the blood vessels in my brain made me feel important. I got to tell someone who works at the hospital what my condition is. It is very important for hospital personnel, family members, and counselors to learn how to communicate with the survivors. I think that the seminar at the Yale School of Medicine that helps first-year medical students learn how to communicate with dying and seriously ill survivors is useful when communicating with individuals with traumatic brain injury. The goals of the students in this seminar are to learn how to talk with and listen to the sick person, learn how to establish a professional relationship without the intrusion of friendship, ascertain the meaning of compassion without sentimentality, and the need for humility in the context of the physician's ignorance. Learn the common frailty as human beings and understand that each survivor needs compassion as they deal with the situation, and to understand the people the doctors or family members are caring for. Often survivors feel as though they are being talked to but not acknowledged, or they feel like they are not even in the room as the doctor talks to the patient's parents or relatives and ignore the fact that they are survivors. The survivors are in the room as well. Survivors need to know that the people caring for them have not given up on them and do not think of them as objects. Although survivors want to create a bond with their doctor, it is difficult for the doctor to create a bond to them. They will have to soon say goodbye after treatment and might not ever know how things turn out in the future. That is why it is important for healthcare professionals to learn how to create appropriate relationships. It is difficult to learn how to be compassionate because as humans we want to add sentimentality to it. But sometimes if a caregiver goes too far and does things for the survivors they are capable of doing on their own, or make them feel inferior, it may disturb the effectiveness of the treatment. The caregivers may not know how to be compassionate to the survivors, so they need to learn how to express that issue to the survivors so that they can understand that the caregiver is willing to work on this problem. When I read for humility in the context of the physician's ignorance, I thought of when the doctors did not know what my abnormality was, and they told me that I was going to be sent to another hospital for further testing. And if the doctors and nurses would have taken the time to talk to me further, it may have been able to calm my nerves as I prepared to ride to the next hospital. Once the survivors are diagnosed with a traumatic brain injury, it is important for all of the caregivers to understand the survivors and the disease so that they can be prepared to help the survivors get through their daily activities. For instance, after having certain procedures done, some survivors may need assistance eating, drinking, and other daily functions they are accustomed to doing on their own. They may become upset that they cannot perform these tasks on their own and lash out. The caregiver may be trying to help and not understand why the survivors are upset, but they have to consider how they would feel if they were in the same situation. Being a caregiver, especially a spouse of survivors, can be difficult. It is important to understand that the survivors are just as frustrated because they want their regular lives back. One example of how the survivors may hinder their recovery is to go against the doctor's instructions to rest and allow their body to heal because they feel better and want to continue on with daily life as normal. It is important to know the survivors' limitations and understand that they are probably trying to push themselves just as hard as you are, if not more, and will probably overwork themselves. It is acceptable to encourage your loved one to reach for their goals, but it is important to watch for signs that the loved one has had enough for that time and needs to take time to relax. Some signs that a survivor of traumatic brain injury needs to take a break may be getting angry, irritability, and lethargia. Be sensitive when suggesting that your loved one needs to relax because criticizing and telling survivors what to do will often irritate them and force them to push themselves even more. Brain injury survivors' attention span may not be as long as it was in the past. This may be hard for the survivor and the caregiver to deal with because it will make it more difficult to complete tasks because survivors are easily distracted. They often start a new task and forget to finish the first. It is important to understand that the lack of concentration is frustrating for the survivor because they want to complete their tasks and they may need your help to complete them, sometimes without feeling that they are also disappointing you. Survivors often find it difficult to express their ideas or explain themselves through speaking because they may have trouble finding the words they want to use. The website Emotional and Behavioral Consequences of Head Injury states that some of these survivors may have difficulty with spelling, writing, and reading as well. The survivor may have trouble taking turns when talking to others, maintaining a topic of conversation because they may forget what they want to say, using an appropriate tone of voice, determining when people are using sarcasm in a conversation, and being able to understand the meaning of fast-paced conversations. Survivors may exhibit some form of amnesia. Anterograde amnesia is one form of that a survivor may show signs of. In this state, a survivor may be unable to retain continuing events. The survivor may have problems learning new things even when they are proficient to understand them and are able to repeat it. It is hard for them to actually do so. Eventually, a survivor's condition may improve, but because of the damage to certain parts of the brain, they may still find themselves struggling to remember things. Some survivors may experience retrograde amnesia, which is when they have difficulty recalling events which happened before the head injury. Thus, the survivor may not recall events that happened weeks, months, or years before the traumatic brain injury. Every survivor is different, but as the brain heals, retrograde amnesia shrinks and the survivor is able to remember some events. However, some gaps may remain. Another problem survivors may have is issues with visual and perceptual functions. Some survivors may have problems recognizing faces, shapes, or objects. They may be further frustrated by the fact they have double vision, changes in the field of vision. There may be damage to the muscles that control movement of their eyes as well. This damage may cause some individuals to have issues judging the distance between themselves and objects. If you find your loved one ignoring one side or area of space, they may be suffering from unilateral neglect. According to Emotional and Behavioral Consequences of Head Injury, survivors may become depressed and could feel like crying every day. Because of this, they could lose interest in the activities they enjoyed in the past. They could have changes in their appetite, which in turn will affect their weight. They also may have substantial changes in sleep habits or have insomnia. These changes can make survivors feel worthless or guilty because they cannot live up to who they want to be. All the aforementioned may cause them to have recurrent thoughts of death or suicide attempts. If the head injury occurred in an accident, the survivors may relive the incident that caused them to struggle through their day. They may exhibit flashback episodes where the survivors feel as though they are reliving the event over and over again. They may have repetitive upsetting memories or nightmares that affect their daily lives, and they may react to certain situations that may be uncomfortable for others. Survivors may numb themselves as they try to adjust to their new life. When they do so, they may feel or act as though they do not care about anything. They may feel like they do not fit in with other people and not know how to act in public. Survivors may also lose interest in normal activities, avoid some places, people, or thoughts that may remind them of their brain injury. They may sometimes find themselves feeling like they have no future because of their new shortcomings. Some individuals with traumatic brain injury may be startled easily. They may feel insecure about their reaction and have an extravagant response to things that startle them. They may feel tense and be on guard because they feel more aware of their surroundings. It is important to understand that traumatic brain injury may cause personal changes in all survivors. Emotional and behavioral consequences of head injury says personality changes are often an exaggeration of the person's pre-injury personality, in which personality traits become intensified. Sometimes the survivor could go from having a lot of energy, being easygoing and thoughtful, to seeming to be self-absorbed, easily angered, and unable to show enthusiasm for anything. These changes could be a result of depression or cognitive issues. The website gives the example of executive dysfunction. Executive function refers to a set of mental skills that help individuals complete tasks. When the frontal lobe is damaged and these skills are affected, the person cannot control their behavior. If caregivers notice dramatic changes in their loved one, they may want to suggest that the survivor go for a professional assessment. Sexual interactions between couples are important to show how much the people care about one another. Unfortunately, when people have a traumatic brain injury, their sex lives may change, which is frustrating for the survivors and their partners. Survivors may find that they are less interested in sex. They may not daydream or feel the yearning about sexual activities that they had in the past. Unintentionally, they make their partners feel unwanted. In other cases, a person may have an increased desire for sex after traumatic brain injury. They may appear to be unable to control themselves, and in some cases may make inappropriate sexual advances towards others. Sometimes they want sex so much that their partners feel uncomfortable. Sexual functioning and satisfaction explains that some survivors may still have the desire to have sex, but have difficulty becoming excited or aroused. In these cases, the men may have trouble getting an erection or keeping it. Women may not have enough moisture in the vagina, and sexual activity becomes difficult and painful. Some survivors may have trouble reaching orgasm or climax, causing them to become frustrated because they cannot find satisfaction while having sex. This frustration may make the survivor not want to have sex. In the article, 11 Ways to Comfort Someone Who's Grieving, the author suggests that you mention the traumatic brain injury and the changes that have occurred in the survivor's life. Ignoring the fact that something has happened to loved ones and has changed them will hinder them from recovering and adjusting to their new lives. It is important to offer hope to your loved ones because they need to be reassured you will be there for them. They will also remember and appreciate the fact that they had someone there for them to get through their hard times and find a renewed sense of themselves. Calling survivors when you are not able to be with them can help them feel as though they are not alone in their personal fight to get through their struggles. Another suggestion the author had was to write a letter to the survivors, letting them know that you are thinking of them and you want them to be strong and happy. Survivors' pride may sometimes prevent them from asking for help when they need it, which may delay their recovery as they push themselves to do more. One thing you may do is ask them what they need help with. Try not to be condescending or disrespectful, and make them feel as though they are important and valued as a person as you do so. It is important to be sensitive to the survivors' differences. They are adjusting to the changes that are occurring to them, that they have to learn whom they will be when they recover, and they need you to support them as they adjust to the new them. Try not to criticize them for what they can or cannot do, or the way they act, or force your beliefs of what they should do onto them. Survivors often feel isolated after traumatic brain injury. Try to suggest that they spend time with their friends or family watching a movie, listening to music, or doing physical activity that can make them all feel better about themselves. I know it is hard not to tell your loved ones what they should and should not do, but sometimes all they need from you is to listen to them and be there for them. It is important to think of what you would do in the same situation and multiply it by 10. Would you want to do the complete opposite of what you are saying? Your survivor may want to do it just to spite you and search for something else to do to prove to themselves that they can prove you wrong. The article suggests, unless you are asked for your advice, don't be quick to offer it. Let the survivors know what you are feeling. It is more important to let them know that you do not know what you want. You do not know what to say or do, but are there for them when they need you, than to let them feel like they are all alone in their fight. However, do not make them feel as though they have to take care of you and your feelings because they have enough on their minds trying to take care of themselves. Handle their anger gently. If you address them about being upset when they are expressing their emotions, you may make them feel insecure and take it out on themselves. Try to be as non-threatening as you can be and help them to understand why they were upset. Keep your promises to survivors. If you cannot, try to explain why you cannot and make arrangements to reschedule or do something else. Traumatic brain injury changes the lives of everyone close to the survivor, but if their loved ones, doctors, and counselors work together to help them find themselves again, the survivor will become stronger and happier versions of themselves. Thank you so much for your time as you listen to me talk about a subject that is very important to me. I hope you have a great day. As Janet and Brendan say in the webinar, Who Am I Now? As you go through life with survivors, you and the survivors will miss who they used to be. And you have to learn how to adjust to who they have become as you help them learn about themselves. This journey is going to change the survivors, who they are, and who they will be. If you do a successful job helping them, it can change you as well. Hopefully for the better, as you face the journey with your loved one.